They lied. This wifey got on the where he picked her up at. Oh my God. Oh my God. And my bills are due on the 3rd. And I'm fine. I'm not short. I play by the rules.
I got it. The rules are changing. That's the problem.
Yeah,
If you
well.
play by the rules and the rules change, then you have to catch up to what the new rules are.
Okay, well, I try to stay up for my own health and try to keep up.
So your pain. He disappeared for a while. How did you get your pain managed then?
He didn't really disappear
Okay. Well, you good.
because I didn't have a break in him. I mean, he got kicked and
I have other patients that have not been able to find him.
oh,
So
and you can't now, and they lie. I'll
Yeah.
call that frickin' office and ask this dimwit wife of his what their office hours are. Will you be there for me to come down? And this was regarding a Soma's prescription that they insisted I needed to pick up, which I finally called my primary and he called it in at Bergam.
okay.
You don't even need to pick up a script for Soma. Anyway, I left work, went down there. They don't answer their phones. It's a bad situation. I don't want to just go on and on about it but I don't know what to do.
I don't know where you can run to.
That's exactly right.
So I want to make a plan for you, okay?
Okay.
So I will help you, and I will
Okay.
prescribe for you now, because I'm already under the bus. I couldn't be more under the bus than I am.
I know. Let them look, though,
But
right?
investing in me is, now my patients are starting to get,
I can't see. My glasses must be whacked. That's better.
my patients are now starting to be discriminated against because they're seeing me. So
Okay.
you got to know that
I'm
that
in for it.
Throwing in with me is
I'm in for it. It's fine.
it may be short.
What are we supposed to do? We, these addicted people with chronic pain.
Not addicted, dependent.
Dependent is exactly right, and I very seldom say addicted. I have a physical
Now
dependency.
you will withdraw if
Yes.
your
I know.
meds are stopped, which is a very vulnerable place to be.
Yeah, I have experienced
And
that
I want
in
to
my
co-create
past.
something with you that's going to free you from that, and we'll figure something out.
I'm open. I got to do
Because
something.
you got to get out of this system. The system is insane. There's a
Oh,
reason not to
my
trust.
God, he's-
There's a reason not to
yeah,
trust
he's an
someone
idiot.
who's lying. And
He's
and
an idiot.
what makes him an idiot to you?
Oh, good God, you walk in there, and before this guy knows hardly anything, he's going to give me a prescription for methadone for 6 a day. I mean, that's enough to drop an elephant. I don't care how narcotic dependent I am. He's stupid. He's on drugs or something. There's something missing upstairs with him. I don't know what it is. Oh, God. The amounts of problems, incorrect prescriptions, mistakes on prescriptions, stupid stuff that comes out of his mouth. And my God, I could go on and on and on. But unbelievable. Unbelievable.
Well,
So I can't say, and I really wanted to, because he's up by the hospital, and I live up there, and I'm desperate for somebody, but I'm not going to some stupid shrink. This Suboxone stuff, I don't want to have I can't see these, I don't want to have anything to do with that.
Good call.
Switching drugs or,
good call. Well, Suboxone is a agonist-antagonist.
so it answers the brain's demand for opiates, but,
It blocks the opiate receptor.
oh,
So it sucks for pain.
well, that's what this is about. This isn't about the
Suboxone
drugs.
is for withdrawal.
Drug addicts.
Okay. Now he says he's a pain doctor, but
Who, this psychiatrist?
but all he does, he's only got one tool. It's called
Right.
Suboxone.
Yeah.
Aaron only has one tool. It's called a needle. Okay. And Drew only has one tool.
Yeah, it's a prescription pad.
Yeah, and so you don't have a multidisciplinary approach in that sort of context.
Right.
Now, if you wanted to send you to a counselor to help you, blah blah blah. I mean, you've done a lot of your own work. I can tell.
I do, and I've been at this for a long time, and I finally am at a place where I manage my meds and my life, and I can. The change it makes to my everyday life is worth the hassles I'm dealing with. I work closely with my primary doctor, Dr. He's up at the state clinic.
Oh, he's a good guy.
Yes, he is. And
Mountain climber. He
Yeah.
climbed to Everest or something.
Oh, I
tried to hire him here,
most of
but
his
we
clients.
couldn't pay him the same amount.
And anyway, so Doctor,
So you work for the state?
I do, and I just come off of another round of 6 weeks of therapy, and now I'm into some deep tissue therapy and working
What therapy is that?
for my hip that's a bad hip.
So that's physical therapy?
Yeah, it was physical therapy, and now I'm into a deep tissue therapy, and I've never had that in all the years I've been dealing with my accident from skiing and the hip and the replaced hip with a bad hip and losing it to, first they bolted it, and then avascular necrosis, and then new hip, and then now a bad reject hip, and on and on. But it's just one of the main things and that caused me pain and all that goes with it. But I really like him. And
Yeah,
I work
you should know
closely with
he's a mid-level. He's a PA or a nurse
him.
practitioner.
I know,
Yeah.
so
All right. So, wow.
that's just an FYI for you.
Yeah, I'll take it. It's
Okay.
great.
But let's get me a copy though, because I do think that's not
Okay.
a copy. But
Put me in charge of that.
girls, yeah.